Hi, everyone, and thank you for joining this Facebook Live broadcast. I'm Allison Johnson from Windsor Regional Hospital, and it's been nearly a year since the World Health Organization declared COVID-19 a pandemic, and some of the first people hit with this virus say they still haven't fully recovered. Today, we're discussing the long-term impacts of COVID-19 and what it means to be a long hauler. So please join me in welcoming our guests for this important conversation, Dr. Wassim Saad. He is Chief of Staff and VP of Medical Affairs at Windsor Regional Hospital. He's also leading a regional study looking at the long-term impact of COVID-19. Good morning, Dr. Saad.
Good morning, Allison.
Angela Cheung is an internal medicine specialist at the University Health Network and co-lead of the COVID-19 Perspective Cohort Study. And this is a national project looking at the outcomes in patients with COVID-19 and their family caregivers. Good afternoon.
Hi, Allison.
And June Muir, CEO at the Unemployed Help Center in Windsor, a familiar face if you've joined us before. She is one of the first people in this region to test positive for COVID-19 and also a long hauler. Hi, June.
Hi, Allison.
And hello to all of you joining us today. This is Coping with COVID. It's an interactive conversation. So if you have any questions for our panelists throughout the conversation, please post them in the comment section below, and we will try to include them during this live stream. So first question of the day is for June. June, you came down with the virus almost a year ago after traveling to New York. How are you today?
Well, Allison, I'm much better, but I'm definitely a long hauler. And I've now developed asthma, so I get short of breath. I had some difficulties, obviously, breathing when I had COVID, went for testing that showed my lung capacity rate was slightly down. So I'm experiencing those symptoms. I've lost hair. I have heart palpitations. I'm very tired still. I still get very fatigued. So I still have many symptoms, but I can't complain because many have much worse.
So you've talked to me before about what this journey was like. You find out you have an illness that you don't know too much about, and then the recovery process starts. When did you first start to hear the term long hauler and realize that that might apply to you?
So I didn't hear about it till June. I got COVID in March. March 9th, I started to get ill, and I was home for 3 months. I was getting positive and negative results, and I still had symptoms. So I couldn't figure out why I still had symptoms. You know, I was taking care of myself and, just looking at the normal flu, thinking about the normal flu, it should be gone by now. Why is this not gone? And then I started reading about long haulers and I realized, hey, I'm a long hauler. Finally got back to work and I'm not that person I was. I could go and work 14 hours, exercise, and I can't do that today, but I'm getting there, and each month does get better, but I'm more concerned about my lung capacity because when you exercise, obviously you have to have good lungs to exercise, and I'm just not there yet.
It sounds frustrating.
It is frustrating. It is.
So a question for Dr. Saad. What do we know about the lasting impacts of COVID-19, the impact it has on patients? And then how do you address concerns of patients like June who want to know, when will they get back to being their normal selves?
It's a good question. And unfortunately, we don't have all the answers right now. We do know that more and more people are presenting with symptoms similar to what June is describing. That are being looked at and studied to see if they are fitting with the long haul symptoms or what we call post-COVID. The most common symptom being fatigue, but then there are symptoms such as shortness of breath, chest pain or tightness, and even a cough that can persist many weeks or months beyond the initial infection. We also know that the severity of your initial COVID infection does not necessarily translate into whether you are going to get long haul symptoms or how severe the long haul symptoms. The best advice that we have right now, as we try to gather more information and do the studies that we are embarking on, is to bring those symptoms to the attention of your healthcare provider. and then have them investigated. So June, for example, is probably reporting a cough and some shortness of breath, and then had some testing done to investigate her for the possibility of developing asthma. If she's having chest pain or shortness of breath or palpitations, then they would be investigated like we would normally investigate any other cardiopulmonary symptom, whether that's with imaging like a chest x-ray, an echo, an EKG, a heart monitor, and with any of the symptoms that linger beyond the initial COVID infection. The important thing is to at least bring it to the attention of your healthcare providers and have them investigated in case you've developed something that's new, or it's going to add to our database of knowledge for what constitutes long haul symptoms and how we can better address it and treat it in the future.
Well, let's talk about that for a minute and the role of research in terms of answering the questions that people so desperately want answers to. And Dr. Saad, both you and Dr. Cheung are involved in studies looking at the long-term impact of the virus. Can you talk about the work that you're doing locally, looking at the potential impact on the virus in Windsor, Essex?
Yeah, interestingly, this came up through a question that I had from media asking me, is anything being done for these patients who are testing positive and are having symptoms, long haul symptoms? And I thought to myself, well, you know what? I know there are studies ongoing in the world and nationally. Why don't we collect our own database of Windsor Essex patients? So I contacted my fellow chiefs of staff at HDGH as well as Erie Shores Healthcare. They were on board, very supportive. And so I put together a proposal that went to WeSpark. So we received some funding from WeSpark, which helps launch, local research projects and interest. And now we're in the process of planning it in terms of how do we gather that information, how do we contact everyone who's been tested positive to find out what symptoms they've had that have lingered. And we're hoping to contribute again to the national and multinational database of long haulers to see if we can determine if there are patterns, if there are certain things that will jump out at us. And that's why we're also very excited to have Dr. Cheung with us today, who can talk about her research project nationally. And again, trying to add to that sort of worldwide database to see if we can get more information.
Absolutely. So let's bring Dr. Cheung into this conversation now. You're working on the largest Canada-wide study looking at this. What are the biggest questions that your team is trying to answer through the Kankov project?
So there are many questions that we're trying to answer. However, the overall really objectives of the study is really to understand the short and long-term outcomes of patients with COVID-19. And actually, we look at their caregivers as well. The other objective is really to understand what predicts these outcomes. So we are collecting social demographic data, clinical data. We're collecting genetics and what we call multi-omics. So these are the sort of epigenomics, transcriptomics, and biomarkers and other kind of testing that is not really available on the clinical front. So the good news is that I'm sort of representing a group of more than 100 investigators across Canada. There are researchers, there are basic scientists, there are neurologists, cardiologists, nephrologists, respirologists. We are all sort of working together to try to understand this. And we're looking to collect about 2,000 patients across the provinces. The major provinces are Ontario, Quebec, BC, and Alberta, although Saskatchewan and actually Manitoba is coming online as well. I can tell you that we currently have about 800 participants in the study. They're in different groups because we want to understand sort of really how people do across the spectrum of severity of illness. And so we're recruiting 1,000 non-hospitalized patients and then 1,000 hospitalized patients, split between those who were admitted to the ICU and on mechanical ventilation, and those who are just on the acute care wards and not in the ICU. And because actually people came to us in this pandemic and say, wait a second, back in March and April of last year, there really not adequate testing, and they didn't satisfy the criteria for testing, but they have symptoms that are consistent with COVID. And so we added a cohort of people who have never had a positive PCR test as well. And we currently have about 295 patients in that cohort. And we're looking at both whether they have antibodies to COVID, but we also look at, we're trying to look at the cells, like the T cells, the immune cells, to see if they actually have memory of being exposed to COVID. Because we know that antibodies don't last forever. So looking at the T cell memory is an important piece.
So a lot of work happening with that project, and I know it's still in the early stages, but what have you been able to learn so far about long haulers?
So I think we really need to separate sort of the cohorts of patients because, I work with my co-lead, Margaret Herridge, who's Dr. Margaret Herridge, who's actually a intensive care physician. And we, even 20-something years ago, we did studies on ARDS, which is a severe sort of respiratory distress, acute respiratory distress syndrome. And we know that even 1 year out, so our study was 5 years, so even 1 year out, some of those patients still have symptoms, partly because of what they had, like, influenza, pneumonia, whatever they had, but partly because of what we had to do to them to keep them alive. And so, some of the management is really quite, if we put anyone in a bed and sort of like put them, sedate them and keep them in a bed and try to ventilate them because their lungs were so bad, they are really weak when they come out of the ICU. So that's one group of patients that we know have sort of functional impairment, even a year out. But what I think is surprising, as June was saying, is that those who are not hospitalized have residual symptoms. Because usually when you get the flu, you may be, really sick for a couple of weeks and then you get better. And usually by a month or so, you feel better. And by 3 months, definitely, you sort of recover from the flu. But this is not the flu. This is COVID-19. And so we're learning about sort of the residual symptoms. And usually when we think about prolonged effects, we're really talking about more than 3 months out from the initial infection.
Do we know what the likelihood is that somebody who gets sick with COVID will become a long hauler and have symptoms months down the road?
That's what we are trying to study, is trying to figure out why do some people don't have any symptoms, right? We know we heard about the asymptomatic folks, or even have it mildly, a couple of days, a few days, and then they get better. And why do some people actually have lingering symptoms for months, like for a year? And they weren't, in sort of the acute care sort of language, they weren't that sick, compared to those who were kind of severely affected. Now, there are a couple of things that we have learned through this consortium of investigators. One is that coronavirus is worse than the flu, even looking at the hospitalized cohort. So recently, my colleagues, Dr. Mo Verma and Dr. Fahad Razak, looked at data from 7 hospitals in the Toronto area and compared the flu with COVID-19. And we know that people stay longer, people are sicker, they die more often, they go to the ICU more often. Yes, it affects older people, but actually 1/5 of these hospital admissions were younger than 50, age 50. And so we know it is worse than the flu. So I guess it's not that surprising that for the non-hospitalized group that we are seeing that it's worse than the flu as well, in terms of how it affects people and how long it affects people.
And a question for June. Anyone who has joined us before for these conversations knows that June was sick, but so was her husband, and both at home at the same time. And June, you've mentioned that, at the time you felt he may have had it worse than you. How is he doing now in terms of symptoms?
Yes, so his only symptom is that he's very tired. And he had a fever much longer than I did, we were both very ill, but he seemed to be a little bit worse, but yet I seem to be that long hauler. And I seem to have way more symptoms than he still has, which is good. I'm glad he doesn't. But once again, it's almost a year for me. And I still, am experiencing that fatigue, shortness of breath. I have heart palpitations. And so I'm really thankful that this research is being done. And I'm hoping one day I'm clear of all of this.
Absolutely. A question from somebody joining us from Facebook right now, Arbena, for Dr. Saad, says, my father-in-law is recovering at home after being hospitalized for 3 weeks with COVID pneumonia. He has muscle aches and shortness of breath. What would you recommend?
That's a good question, and he may very well be a long hauler, depending on when that acute hospitalization was. Sometimes it's important to remember that when somebody is in acute care, if they're in hospital, if they're in an ICU, there is a normal period of recovery that can sometimes last weeks, and especially if you're in the ICU, that could last months. So that doesn't necessarily mean that you are a long hauler. It just means that your body takes a little bit longer to recover from such a devastating impact to your body and from not being able to move around a lot because you were in the ICU or in hospital. The other thing that I would suggest is similar to what I had said earlier, in that bring those symptoms to the attention of your healthcare provider. The shortness of breath in particular, most people would recommend some investigations for it, whether that's doing a chest x-ray or a pulmonary function test. We do also have to recognize that sometimes when you're in hospital and you have a test done, like an x-ray or a CAT scan of your lungs, and an abnormality is found, sometimes that can persist, especially if you repeat the x-ray or CAT scan, sometimes even weeks or up to 6 months later. So it's important to know what happened in hospital, so you can compare it for the testing that you're doing outside of hospital. But the important thing is to seek medical attention, explain your symptoms, have them investigated to make sure that there's nothing new that's developed. And then if there is nothing new that's developed, it's a matter of time. If it's a normal part of the normal recovery period for how long you spent in hospital and how bad the illness was while you were in hospital, then again, it's a matter of time. You'll eventually recover from it. But if it's outside of the normal recovery period, then you could end up being a long hauler. And then again, we have to look at some of the research that's being done and see if any suggestions or opportunities for improvement can come out of that research. But that's one of those things where, again, stay in touch with your healthcare provider, explain the symptoms, and have them investigated accordingly.
And one of the things that I've read quite a bit about is one of the symptoms for people who used to be active who have difficulty exercising. Even a year out, people who are, in their 30s, 40s, who used to be able to run marathons now still feel better, but, are winded if they walk up the stairs. What advice would you give for patients in that situation in terms of, do we know, is it better to push through and try and build up the strength again, or is that dangerous?
Again, another excellent question that I don't think we have the full answer to. I can tell you that if it was a regular viral illness or another hospitalization for any other reason where you're either on the ward or in the ICU and you feel those symptoms, we call that deconditioning. And again, I assume that there's nothing else going on. The testing has been done to investigate it, and we're not dealing with another illness. So the best way to manage deconditioning, at least in the early phases, is to start with an exercise program, staying as active as you possibly can. We sometimes even tell people to push through their symptoms. So if you were a marathoner and now you can only do 5K and you're feeling a little bit of short of breath, push through it. Then eventually a week later, you might get to 10K, and then you might work your way up. And even if you're not a marathoner and you're somebody who likes to walk around the block, and you can walk 2 blocks normally, but now after 1 block, you're feeling short of breath and tired and you have no energy. The recommendation under normal circumstances would be, A, listen to your body. It'll tell you when enough is enough. B, continue to exercise. Do not stop it, because you want to try to regain that conditioning level. And eventually you will get there. Now, to say that it's dangerous to try to push through if you're recovering from COVID, I think is a bit of a stretch. I don't think there's any evidence to suggest that we want people to not be active. There's still going to be an element of deconditioning where people will feel fatigue. And the recommendation is still to treat it like any other recovery from a hospitalization, which is do as much rehabilitation that you can, push it a little bit if you can, but obviously listening to your body, and continue to exercise. We may end up getting answers from some of these research studies related to long haul COVID that might suggest otherwise. But to this point, the general recommendation of trying to continue to be active as much as you can in rehab still holds true.
Okay, thanks. Let's talk about the long-term impacts on mental health. We've heard people say, brain fog, anxiety, depression. A question for June: has the experience of living in limbo affected your mental wellness at all?
Absolutely. When I first developed COVID, there wasn't a lot of information. And so the minute I was told I was positive for COVID, I cried. I immediately thought, am I going to survive? What's going to happen to me? I didn't know. It was early in March. And then, of course, as time went on and I wasn't getting better, my anxiety level was very high. So it's a year later, and, I still have some anxiety, not knowing if I'll fully recover. That's an anxiety I'm sure many, many people have, and that's a reality to many of us. So hearing from our doctors today is very reassuring. I'm hoping that I get to be that person that I was, and I'm just trying to follow all the instructions and get where I want to get.
And I've read about people who say that they've worried that the symptoms might have been in their head, or that other people sometimes implied that the symptoms were in their head. Was that something that you've ever experienced?
Absolutely. I thought, okay, is it just me? Especially when Bill did not have the symptoms. He was different than I was. But definitely I thought, am I just, imagining this just because, I've been told I have COVID? But when I was sick for 3 months and I had that cough and, speaking to my family members and my daughter saying, Mom, you can't even have a conversation. You're just coughing constantly. You're short of breath. Then I knew it wasn't my imagination. It's still there, Mom. You still have it. So talking to people and having these webcasts are so important because it's not you. And then you're talking to your friends and you're talking to your family members. They're trying to understand, but no one really does understand unless you are going through it. So it's great to have this, conversation today, and it's great to have the doctors join us and be able to give information to long haulers.
And I think that leads into my next question for Dr. Cheung. The Kankov study is also looking at the impact on family caregivers, and I want to talk to you about why this is important and what do you hope to learn from that?
We have actually, from our ARDS studies, we have been looking at caregivers because it not only affects them in terms of mental health, when they're looking after someone with the disease, it actually affects their physical health as well. So for hospitalized patients, we're actually recruiting caregivers as well. And we expect that it may be similar to sort of what we found in our ARDS studies.
And how are you recruiting those people? Can people sign up on your website, I guess, is my question for
yes.
to participate.
So and I can share some of our learnings as well in terms of just looking after hundreds of patients, right? So I work in the acute care setting, and I also work in the post-COVID clinic. One thing I sort of want to comment on sort of what Dr. Saad was saying, and I certainly agree with him that with most other illness, we do try to push people, I look after a lot of hip fracture patients. After surgery, I push them to get up even if they have pain and get walking and so on and so forth. With this illness, what we have learned with just looking after patients, so it's not based on, blood tests or, things like that, is that there is some similarity between sort of chronic fatigue syndrome and or what's now called myogenic encephalitis and this condition, because with the fatigue issue. And so what we have been trying to do is actually set up some pilot programs to see if it can help patients recover. And we work on sub-threshold exercise. So we like to sort of like, progressively get people to do more, but we don't really want to pass that threshold where they're exhausted for the next 2 days. We sort of try to stay under that threshold. So we don't want to be 1 step forward and 2 steps back. We tell patients that, don't push yourself in the first months. This is actually based on WHO guidance as well. So the group at WHO have gone together in terms of making recommendations around exercise. And yes, some people are marathon runners and, very active people prior to COVID, but then they had COVID. And we usually tell people to go sort of pace yourself and rest and get adequate rest, adequate fluids, adequate nutrition, especially protein, and pace yourself in terms of going from 0 to 1 and then moving to 2 and not jumping to 10. So you may be able to do 10 previously, but you were sick and you were at 0. And so you have to just move 1 step at a time. That's what we have been telling people. And I think that works better than them thinking, oh, I should be better and I should be able to do 10.
Right. And I'm sure it's frustrating for people who are that type of personality who want to start at 10. I can only imagine how frustrating that would be. A question for Dr. Saad. I want to talk about the impact that this could have on the system. If a certain amount of people who develop COVID-19 end up having symptoms that last well into the future, locally we're above 12,000 people who have had the virus in the region. And, if a portion of those people end up having issues that require treatment and care into the future, even emergency and hospital stays in the future, how can the system manage that?
That would all depend on what type of symptoms specifically we're dealing with and what the longer term effects are. As Dr. Cheung mentioned earlier, as part of her study, she has multiple disciplines that are involved: cardiologists, nephrologists, respirologists, general internists, because we do know that the effects of this virus, both in the acute infectious stage, can affect almost any organ. We're learning that long haul symptoms can also be impacting the heart, the lungs, your mental health. So I don't, given the number of patients that we have, it's hard to predict what kind of impact it's going to have on the healthcare system in the future, unless we think that all of them are going to develop a particular subset of symptoms that are going to require a particular specialist's care. And so far we don't think that that's the case. The symptoms appear to be sort of spread out across multiple disciplines. A lot of it does not require, active intensive treatment. Some of it is just time and recovery. But as Dr. Cheung said, if we end up needing to set up sort of rehabilitation programs that are specifically tailored to the effects of COVID and long haul symptoms, then that's something that we're certainly going to look at and draw on our current expertise and see if we need to recruit more people to try to help with that. But there's still too many unknowns to know whether it's going to, bring down a certain sector or a certain part of our healthcare resources at this time, because there's just too many unknowns and it affects too many organ systems.
Right. We have a question from Janet Johnson, who's viewing today. She says, my sister and her husband both had COVID back in March. My brother-in-law, who is 82, was hospitalized and my sister was sick as she remained at home. She seems okay, but I was wondering, does having COVID previously offer any protection against getting the virus again? Dr. Saad or Dr. Cheung?
Sure, I can take that one. So there is some protection, and there are studies looking at that. There's about 85% protection against sort of COVID-19. The problem is that there are many variants out there. I think you have heard of the UK variant, the South African variant, the Brazilian variant, and there's a California variant, and now I heard that there are some variants from India as well. And so there are, how much the protection, it's really unclear, but to the original virus, probably about 85%. So how does that compare? So if you get vaccinated by either the Pfizer or the Moderna vaccine, you're about 90-something% protected. And so there has been some discussion, especially those people without with sort of symptom resolution. Those who have had COVID can get a vaccine, but maybe only one dose of the vaccine may be needed. And these are still early days. We're still looking at data, but that's sort of some of the things that we have been looking at. And I also want to sort of just add a comment to what Alison and Dr. Saad was saying in terms of I have been advocating for the provincial government, Ontario government, to support some centralized sort of post-COVID clinics in Ontario, maybe 3 or 4 of them, so that they are connected to each other. We can coordinate care. We can look at data together and understand this better. BC province has supported 4 of them. I was just chatting yesterday with the person who was instigating this, who's a nephrologist. She advocated last year for BC government to have sort of coordinated care. So that there won't be any unnecessary referrals to all these specialists and unnecessary sort of, visits to the emergency rooms and things like that. I think it would be great if we can all sort of come together to try to advocate for something like that.
Sounds good. A few questions that we've had come in about the vaccine. Dr. Saad, is it safe for people who are still suffering from COVID-19 symptoms, even months out, to receive the vaccine?
Yeah, the most recent guidance that we have on vaccination in people who have COVID is, number one, while you have the acute illness, you should not receive the vaccine. As Dr. Cheung said, you will be offered some protection from the natural infection of COVID at about 80-85%, but we don't know how long that necessarily lasts. Some people say it's 60 days, some people say it's 90 days. And also with the shortage of vaccine that we have right now, we are telling people who have had COVID that they may not be top priority right now. Obviously, if we had enough supply, anyone could get it. So recommendations right now are to wait at least 60, some people say 90 days after an acute COVID infection. Even if you still have some residual symptoms, you are still a candidate to get the COVID vaccine. But of course, with the shortage that we have, if you're a healthcare worker, if you're over 80, if you're high risk, those people are being prioritized, and people who've had COVID can wait a little bit longer before they get their vaccine.
And I don't want to get too far off topic here, but we have had a lot of calls, a lot of questions about the vaccine rollout. When might you be getting it and who's next in line? The Windsor Essex County Health Unit has set up a one-stop shop webpage full of information, and we're going to include this in the comments section below. So if you're interested in any information related to that, check that out, and they're happy to help with any questions on that. We're going to be heading into our final question. I think that we're wrapping up this conversation, but if you do have any more questions for our panelists, get them in now and we'll try to include them. Before we wrap up, I just want to go around the table of panelists here again. What advice do all of you have for people at home who are still suffering, wondering what's happening with them, when they might start to feel better? I know we've talked about a lot of things today, but anything that we haven't covered? And Dr. Cheung, let's start with you.
I would really encourage, people to participate in a research study, because that's the only way that we can systematically try to collect data and understand this as well, and really try to work to provide solutions. And so I encourage you to sort of, help everyone out in terms of trying to understand this better.
And we will include the links to both the study that Dr. Cheung's working on, the Kankov study, and the study through WeSpark that Dr. Saad is working on. Links to both of those in the comment section below if you want to learn more about either of those. Dr. Saad? Last words?
I completely agree with Dr. Cheung's assessment and recommendation to participate if you can in a research study. Number 2 would be to have patience. We don't have all the answers right now. Number 3 would be to seek medical attention for symptoms that are concerning you. If you really have chest pain, shortness of breath, palpitations, residual cough, anything that you're concerned about that feels out of the norm, seek medical attention, have it investigated. And hopefully, if we do end up setting up these long haul clinics or have other resources that are going to be available to patients, watch out for those and obviously join and participate if you can.
We did have a question here, a quick question for Dr. Cheung. Carrie wants to know when the results of your study will be available.
There will be different parts of results. One of our first look was actually at antibody levels of patients. And so we sent, 400, 500 kind of samples. And they ran out of, Canada ran out of vaccines. Well, they ran out of reagents. And so there has been a delay, but they're running again. So I'm hoping that at least that piece of information can be released. And we, as soon as we get results, we actually tell our participants as well. So it's not like, obviously if we have overall results. And so one of the first piece of results is actually what I just told you, that we were looking at COVID compared to influenza. And COVID is worse than the flu for patients who are hospitalized. That's the first thing that we learned from this sort of consortium projects per se.
So information will continue to flow from this project probably for a long time, I'm guessing.
Yeah, I'm hoping, yes.
All right. And June, again, last words over to you for the day. It was your idea to have this conversation. You said there's a lot of people now getting pretty frustrated who have had symptoms for a long time, lots of questions. It would be a good idea to do this. What final thoughts do you have for people joining us today?
So I just want to give the long haulers some advice. Don't think it's all in your head. As Dr. Saad said, call your family doctor. Reach out for help, get your test done. I've been for several tests and I've learned many things. And I think it's great to know about your own health and where you're going to end up. So call your doctor. And I just want to give a shout out to Dr. Cheung, a shout out to Dr. Saad. He is always so great to chat with. And I thought today's conversation was so very helpful. So thank you.
Thank you, June. Dr. Saad, Dr. Cheung, thank you all. Thank you for your time today. A really important conversation and one that I'm sure is not over. We'll continue to add to this conversation as we progress. Thanks to all of you who joined us today. And again, additional information on both of the research projects can be found in the comment section below. And also a link to the Windsor Essex Health Unit with the most up-to-date information on the vaccine rollout locally. If you have any other questions for us, you can always email at cwc@wrh.on.ca. And in the meantime, that's it for us today. Thank you, everyone, for joining us, and stay safe, everyone. Cheers.
Thank you. Bye-bye.
Thank you. Bye.